So delayed puberty is typically defined as puberty that starts under the age of 8 in girls or under the age of 9 in boys. And there could be a variety of reasons for this. Some of the most common reasons are around what we call constitutional delay in growth and puberty. And this simply means that a family tends to be late developers, and this does run in families. So you might find that mom, for example, might report that she had her first period at age 15 or 16, and dad might report that he was still growing, for example, at university. And this does run in families. Other causes to think about are something called hypog, which is short for something called hypogonadotrophic hypogonadism. And this basically means that the pituitary gland isn't working properly or the hypothalamus isn't working properly. And so that causes low puberty hormone levels in the blood. And this then causes the testis not to work as well in the boys and not make enough testosterone, or the ovaries not to be making enough estrogen in girls. And there are many different causes for hypog. It could be something like a history of damage to the pituitary gland, for example, through surgery or through radiotherapy. It could be related to chronic stress. It could be related to very low weight, so a low BMI or body mass index. And that could be caused either by under-eating, so not getting enough calories in, or sometimes over-exercising. And we can see this, for example, in people who are training a lot. For example, they might be gymnasts, they might be swimmers or marathon runners, and they do a lot of exercise. We also see it sometimes in patients where there is other medical underlying conditions, and it's important that we think about all these scenarios. It's also important that we think about chronic medical illness. So when we find patients who have a long history of an ongoing medical illness, we do find sometimes that the body is so focused on dealing with that long-term medical illness that the body doesn't really switch on to start puberty. And finally, it's important to think about specific syndromes. For example, Turner syndrome, which can occur in girls, and also thinking about Kalman syndrome, which is another common one. And Kalman syndrome can happen in boys or girls. And a classic association with this is a lack of sense of smell. So if I see a patient presenting with delayed puberty, the first and most important thing is to take a detailed history. And that would be specific to whether it's a boy or a girl patient. But also I want to know about the family. I want to know about eating habits, exercise habits, general health, medications, and drug history as well. Once we've got the history, the next bit would be to examine the patient. And this will involve examining puberty and staging puberty. So trying to see physically how far along puberty the young person is. And that's something difficult to do over the telephone or over video. So ideally, I'd want to examine the young person face to face in the clinic room, obviously with sort of permission and consent from the family member accompanying the young person. Once we've done the examination, which would include height, weight, body mass index, and a puberty staging, and also checking for any signs of chronic illness, we would move on to thinking about what sort of tests we need to do, what sort of investigations we need to do. And a lot of the time, I might need to do a small blood test, and that would be to look at the hormone levels in the blood, and also have a look at markers for general health and well-being. So we might do some kidney function, a full blood count, but also check the specific hormone levels like thyroid hormone, LH, FSH, and if it's a boy, testosterone levels or estrogen levels in a girl. I sometimes also need to do some imaging, radiology imaging tests. So that might include an X-ray of the hand and wrist, something called a bone age X-ray. Bone age is really helpful because they help us determine how mature the body looks compared to a person's actual age. We also sometimes need to do an ultrasound scan, particularly in girls. We might want to look at have an idea of how the uterus and the womb is developing, what the ovaries look like. And we may sometimes need to do an MRI scan, which is a special scan looking at the brain and in particular focusing on the pituitary gland or the hypothalamus region as well. Some of these tests can be done on the day, but some of them may need to be done and booked in for on a later date. So in a lot of cases with delayed puberty, we may consider watchful waiting, so where we just sort of see how things go and review the patient in about 6 months' time and catch up with the family again. Part of that decision really is based on how quickly things are progressing or not, how anxious and worried the young person is, and a little bit in terms of the findings from our clinical examination and our test results as well. So sometimes we will just watch things and see how they get on. But other times we do need to get on and think about treatment. And so treatment would be based on what the underlying cause of the delayed puberty is. If it's more to do with problems with weight, for example, and a low BMI, then we would have a chat with the family about how we can optimize the young person's calorie intake in a way that is safe and that is agreeable to the family as well. If it's over-exercise, we need to think about how we can keep the young person active, but limit the exercise or change the exercise so that the body BMI becomes a healthy BMI and the young person can progress through puberty as well. In terms of specific syndromes or where we find that actually puberty just isn't progressing, we would need to think about starting some medication to help kickstart puberty or help puberty progress all the way through. So for boys, this would be thinking about testosterone injections, and we normally would suggest giving injection of testosterone every 4 weeks, and it's what we call an intramuscular injection. So it has to go into the muscle, and the best way to think about this is it's like going and having your vaccinations done. So it feels exactly the same as having a little vaccination injection. For the girls, we would need to think about starting some estrogen, and the best way to give estrogen is to give it as a little patch, and the patch is then stuck onto the skin. Normally we say maybe on the thigh or below the belly button on the tummy, and the patch is placed on there and changed twice a week, like a Monday and a Thursday. We would then follow up our patients in clinic, see how they're getting on, see how puberty is progressing. We might need to check some blood levels to make sure that we've got enough of the puberty hormones in the bloodstream, and then have a think about, is it enough just to kickstart the puberty and let the body take over? Or do we need to carry on with the puberty injections until we've actually gone all the way through puberty? And some of that really will depend on the underlying diagnosis. All of these medications are very safe. They're tried and tested, and they are things that we prescribe regularly to our patients.